Welcome to our discussion on a silent epidemic sweeping through modern society. Today, we're delving into the alarming rise in chronic diseases such as obesity, type 2 diabetes, hypertension, and even cancer. Many factors contribute to this health crisis, but one silent culprit often goes unnoticed: hyperinsulinemia. This condition, characterized by chronically elevated insulin levels, lies at the root of these escalating global health issues. Insulin, a hormone produced by the pancreas, is crucial in regulating blood sugar. When we consume food, particularly carbohydrates, our blood sugar rises. In response, the pancreas releases insulin to usher glucose into our cells for energy or storage. However, when we constantly bombard our bodies with refined carbohydrates and sugars, the demand for insulin surges. Over time, our cells become resistant to insulin's effects, leading to a vicious cycle where the pancreas pumps out even more insulin to compensate, resulting in hyperinsulinemia. This chronic elevation of insulin sets the stage for a cascade of health problems, wreaking havoc on our metabolism and increasing the risk of serious diseases. Understanding the link between hyperinsulinemia and these conditions is crucial for effective prevention and treatment. The consequences of unchecked hyperinsulinemia are far-reaching, impacting various systems throughout the body. From weight gain and diabetes to hormonal imbalances and even cancer, the ripple effects of this condition can be devastating. By addressing the root cause hyperinsulinemia, we can take a proactive approach to mitigating these risks and improving overall health outcomes. In this section, we explore obesity and its connection to hyperinsulinemia, a key driver of this condition. When insulin levels remain constantly elevated, our bodies become highly efficient at storing fat. Insulin acts like a master switch, signaling our cells to hoard excess glucose as fat. This process, known as lipogenesis, is amplified in the presence of hyperinsulinemia. Furthermore, high insulin levels inhibit lipolysis, the breakdown of stored fat for energy. Essentially, insulin locks fat in our cells, preventing its utilization. This creates a perfect storm for weight gain: increased fat storage and decreased fat burning. The result is a steady accumulation of body fat, particularly in the abdominal area, leading to obesity. This excess abdominal fat, also known as visceral fat, is not merely a cosmetic concern. It actively releases inflammatory molecules, further exacerbating insulin resistance. This vicious cycle of hyperinsulinemia and visceral fat accumulation fuels the development of obesity and its associated health risks. Addressing hyperinsulinemia through dietary changes is paramount for tackling obesity. Reducing refined carbohydrate intake and minimizing frequent snacking can lower insulin levels. This allows the body to shift from fat storage to fat burning, promoting sustainable weight loss and improving metabolic health. Now let's discuss type 2 diabetes, often portrayed as a disease of high blood sugar. However, the true culprit is hyperinsulinemia. Years of chronic hyperinsulinemia lead to insulin resistance, where our cells become unresponsive to insulin signals. As a result, glucose struggles to enter the cells, causing blood sugar levels to rise. The pancreas, in a desperate attempt to compensate, produces even more insulin, further exacerbating the problem. This vicious cycle continues, ultimately exhausting the pancreas and leading to a decline in insulin production. At this stage, blood sugar levels soar, marking the onset of full-blown type 2 diabetes. However, the story doesn't end there. Hyperinsulinemia also contributes to the numerous complications associated with diabetes. It damages blood vessels, increasing the risk of heart disease, stroke, and kidney failure. It also impairs nerve function, leading to neuropathy. Preventing and managing type 2 diabetes requires addressing the root issue: hyperinsulinemia. Dietary interventions that focus on reducing refined carbohydrates and promoting stable blood sugar levels are crucial. By breaking the cycle of hyperinsulinemia, we can prevent the progression of insulin resistance and protect against the devastating consequences of diabetes. Hyperinsulinemia plays a significant role in the development of hypertension or high blood pressure. Insulin resistance driven by chronic hyperinsulinemia disrupts the delicate balance of sodium and fluid levels in the body. This imbalance leads to increased fluid retention and heightened vascular tone, both contributing to elevated blood pressure. Furthermore, hyperinsulinemia directly impacts the sympathetic nervous system, our body's fight or flight response. It increases sympathetic activity, leading to vasoconstriction, the narrowing of blood vessels. This narrowing further elevates blood pressure, putting additional strain on the cardiovascular system. The consequences of untreated hypertension are severe, increasing the risk of heart attacks, strokes, and other cardiovascular events. By addressing hyperinsulinemia, we can mitigate these risks and improve blood pressure control. Dietary strategies that focus on reducing insulin levels are paramount for managing hypertension. Limiting refined carbohydrates and incorporating intermittent fasting can significantly improve insulin sensitivity and reduce blood pressure. Addressing the root cause, rather than merely treating the symptoms, offers a sustainable solution for long-term blood pressure management. Hyperinsulinemia wreaks havoc on our hormonal balance, impacting both men and women. In women, high insulin levels stimulate the ovaries to produce excess testosterone, leading to polycystic ovary syndrome or PCOS. PCOS is characterized by irregular periods, acne, and difficulty conceiving. In both sexes, hyperinsulinemia disrupts the delicate balance of sex hormones. It interferes with the production and function of estrogen, testosterone, and progesterone. These imbalances can lead to a range of symptoms, including fatigue, low libido, mood swings, and difficulty building muscle mass. Furthermore, hyperinsulinemia contributes to the development of fatty liver disease, a condition where fat accumulates in the liver. This accumulation disrupts liver function, including its role in hormone metabolism, further exacerbating hormonal imbalances. Addressing hyperinsulinemia is crucial for restoring hormonal harmony. Dietary changes such as reducing sugar intake and incorporating intermittent fasting can significantly improve insulin sensitivity and rebalance hormone levels. By targeting the root cause, we can effectively address hormonal issues and improve overall well-being. Emerging research suggests a strong link between hyperinsulinemia and an increased risk of certain cancers. Insulin, beyond its role in blood sugar regulation, acts as a growth factor. Chronic hyperinsulinemia provides a constant stream of growth signals, potentially promoting the development and proliferation of cancer cells. Studies have shown a connection between hyperinsulinemia and an increased risk of colorectal, breast, prostate, and endometrial cancers. This heightened risk is likely due to insulin's ability to stimulate cell growth and inhibit apoptosis, the programmed death of damaged cells. Furthermore, hyperinsulinemia contributes to chronic inflammation, a key driver of cancer development. By reducing insulin levels, we can mitigate these risks and support overall cancer prevention strategies. Dietary interventions play a crucial role in managing insulin levels. Reducing refined carbohydrates, incorporating intermittent fasting, and adopting a low glycemic diet can help lower insulin levels and minimize the potential for cancer-promoting effects. By addressing the root cause, we can take a proactive approach to reducing cancer risk and promoting long-term health. The consequences of hyperinsulinemia are far-reaching, contributing to a web of interconnected health issues. From obesity and diabetes to hormonal imbalances and cancer, this silent threat poses a significant danger to our well-being. However, the most alarming consequence of chronic hyperinsulinemia is its contribution to heart disease, the leading cause of death worldwide. Hyperinsulinemia drives inflammation, elevates blood pressure, and promotes the formation of arterial plaques, all major contributors to heart disease. By addressing hyperinsulinemia, we can break this vicious cycle and protect our cardiovascular health. The key to mitigating these risks lies in dietary changes. Reducing refined carbohydrate intake, minimizing frequent snacking, and incorporating intermittent fasting are powerful tools for lowering insulin levels and improving insulin sensitivity. These strategies empower us to regain control over our metabolic health and prevent the cascade of consequences associated with hyperinsulinemia. Preventing heart disease and other chronic illnesses requires a fundamental shift in our approach to food. By embracing a dietary pattern that prioritizes whole foods, limits processed carbohydrates, and promotes stable blood sugar levels, we can effectively combat hyperinsulinemia and safeguard our long-term health. It's time to recognize the silent threat of hyperinsulinemia and take proactive steps to break the cycle, preventing the development of heart disease and other chronic conditions.